we're here with some of our legislative team in Sacramento, and we're going to be talking about the budget process, the California state budget process, because it is not straightforward. And we want to help to explain our involvement in it, but also the process in general. So I'm Courtney McKinney. I am Western Center's Director of Communications, and I am going to let everybody introduce themselves, and I'll pass it to Jen to introduce herself first.
I'm Jen Flory. I'm one of Western Center's health policy advocates, and I'll pass it on to Linda.
Hi, I'm Linda Way, the other health policy advocate, and I'll pass it to Tina.
Tina Rosales. I use she, her pronouns with Western Center. I am one of the housing advocates. I'll pass it to Chris.
Hi, I'm Christopher Sanchez. I'm a policy advocate who handles issues related to public benefits, to access to justice, and economic justice. I'm going to pass it to my partner, Mike.
I'm Mike Carroll. I'm the policy director for the Western Center on Law and Poverty. And today we're going to talk a little bit about the state budget. Now, the state budget, is the document that every year must be passed by the legislature and the governor that provides all the funding that Californians depend on to, keep a lot of our government running. So everything from schools to the correction system, to health programs, to welfare programs, all of that is a product of the state budget. And the decisions that get made within the state budget literally impact millions of Californians every year. But some people only focus on the budget when January comes around, when the governor announces the release of his budget. And then, of course, in June, the media pays a lot of attention to make sure the legislature and the governor come to an agreement by the June 15th constitutional deadline. But there's a lot more to the state budget than those two major deadlines. Actually, budgets are a year-round process. As soon as one goes into effect on July 1st each year, the government immediately begins the process of starting to plan for the next budget. And so those of us as advocates don't get a rest after July 1st. We immediately begin those conversations with the administration, with the legislature. So by the time the governor comes around with his January budget, hopefully we will have gotten some of the things that impact our clients' lives into that budget. And if we don't, we certainly will work hard over the next 5 months to get that done. So I think that gives you a sense that the budget is really something that is an ongoing process and something that we have to work on all the time at Western Center. So I'm going to pass this to our housing team, to Tina now, to talk about some of the work that she does.
Because of the pandemic and COVID, what we saw was a lot of people were struggling to pay their rent and utilities. What the federal government did was they allocated funding towards emergency rental assistance program, whereby people could apply and receive 100% of their rental assistance for a total of 18 months per participant. And that also included utilities. Now what we're seeing is, even though that we're transitioning from full-blown pandemic to sort of seeing the end of the pandemic, what we're not seeing is folks who lost their job or lost their income are getting that income back. And so people are still struggling to pay their rent and utilities. So one of the things that we are advocating for is more funding for the emergency rental assistance program so that people do not enter a cycle of debt because they simply cannot pay their rent and their utilities if they don't have the money for it. We're asking for this funding to come from the state government, not just the federal government. And we are seeing that by allowing people to have rental assistance, we're seeing a prevention in evictions. And a prevention in evictions also means a prevention in spreading the pandemic. Turning to the second one, we're talking about the homelessness prevention. And this was a bill 1487 run by Assemblymember Gabriel. And what it would do, it would establish a fund for legal services if a person was facing eviction, as well as education. Currently, if a person is facing eviction, you have the option to get an attorney, but that option is not actualized because there isn't enough money to pay for legal services and for education. So even though this bill 1487 was vetoed by the governor this year, we are going forward with this request in the budget. And what it will do is create a fund so that legal services and their partner organizations can hire attorneys and education so that people who are facing eviction and will have representation. Then turning to the last one is funding for affordable housing. Currently, there is a movement to build more housing. And while we appreciate building more housing, we also recognize that that housing needs to be for folks who are low, very low, or no income. And so what we would request from the legislature this year is to invest in funding for affordable housing, supportive housing for low and no income folks.
What has been different in the past 2 years with the budget from other budgets? Mainly, how much money does California have in its most recent budgets, and why?
Over the last budget and probably in the upcoming budget, California has had a substantial surplus. So every year we do an estimate of how much money we think we're going to have for the following year. And this past year, we were off by some $70 billion. That's because a lot of wealthy people made a lot of money in the stock market in the last year, and they had to pay taxes on that. So that surprised a lot of folks, and it looks like the same thing is going to happen again in 2022. We're going to have a large budget surplus again.
So it's an interesting thing. We have a whole bunch of money coming from wealthy Californians, and we are trying to get it out to people who need it. Say a little bit more about the process of taking something from being a bill to putting it into the budget. Why are we doing that way?
Everything relies on money. That's why. So if a person is going to sponsor a bill and it has any type of fiscal impact, it has to go through the budget process. Because what we've seen in the past and with the current administration is that if there is a bill with any type of budget or impact on finances, if that was not already allocated in the budget, it's highly unlikely that the governor will support that bill. And so because, as Mike said, we have an influx of money from wealthy Californians, and right now in unlawful detainer courts, there's only about 3% of tenants who are represented compared to about 81% of landlords. What we're doing is using some of that funding from the wealthy Californians and trying to push any bill with a fiscal impact into the budget so that we can allocate the money appropriately. That's what we're doing with 1487. So even though it got vetoed last year, the governor did have a very supportive message and he wants to see it in the budget. So we're going to run it this year through the budget.
Thank you for that, both of you. Now we can turn to the health team.
So on the healthcare side, we're working to expand eligibility, improve access to healthcare. And one big area where we see there being a lack is individuals being covered. Specifically, Medi-Cal, as I mentioned, is the program for low-income Californians. Unfortunately, undocumented immigrants are excluded from this. So even though they may be low income, because of their documentation status, not all are eligible for Medi-Cal. And so we know that there is high uninsurance, even though we've cut down uninsurance rates, that the number of people who remain uninsured are those who are undocumented. And so we want to ensure that all Californians are insured. And so we want to expand Medi-Cal for these individuals. The state's made some great efforts, but those are based on age bands. And so we want to finish the job in expanding coverage so that all low-income Californians, regardless of age, regardless of immigration status, are covered. And so we're also working to improve the Medi-Cal program, and Jen can talk a little bit more about that.
Another area that we use the state budget is to fill other gaps in Medi-Cal coverage. Recently, we've been able to increase the income eligibility for people who are older or people with disabilities. We've been able to get rid of certain rules like the assets test that prevent people from getting Medi-Cal, and so that is slated to go away in the next couple of years. And one of the things we're going to be looking to this year as a new campaign is to fix something that is known as the share of cost in Medi-Cal. And this means for certain people on Medi-Cal, for example, if you are an older Californian and your income is $1,481 a month, you can get Medi-Cal for free. If your income is $1,482 a month, you have to pay an $882 share of cost to get your Medi-Cal every month. So that means you have to incur that much in medical expenses before Medi-Cal will start paying for your health care. So this is another area where budget advocacy is necessary because it is going to be a significant cost to the state to fix this problem. But because this has been an ongoing problem that hasn't changed since the 80s, we need to address it on a larger level. So the budget is the appropriate tool to use that for.
Can you please briefly explain what Medi-Cal is and how many people in California are on Medi-Cal?
Medi-Cal is the basic safety net healthcare program that provides for most people free comprehensive health coverage. Approximately 14.5 million Californians currently benefit from the program. So that's about a third of all Californians, and it includes half of all babies born in California. So it's not just a safety net program, it's an incredibly important means of accessing health coverage in California.
Over this last budget, we were able to make some significant impacts, though. We actually reduced our poverty rate by 700,000 Californians. And that's because we put a lot of money just making sure that people had more cash. We gave higher grants to people on CalWORKs and on SSI. We were able to give stimulus checks to low-wage working Californians and other folks who were very low income. And of course, things like the minimum wage increase and our state earned income tax credit are really helping to get money into the pockets of low-income folks. And 2022 is going to be another opportunity to make a major dent in poverty. We're making real strides in California. We have the opportunity to get poverty at the lowest level that we've had in decades. Unfortunately, we have a large budget surplus with which to do that. So much of our work this year is going to be, once again, getting money into the hands of low-income Californians.
The way we see this is really on how can California ensure that folks have their basic needs are being met. And some of the things that we're going to be advocating for in this budget cycle is ensuring that all Californians, regardless of their immigration status, are able to access food through California's safety net program, the California Food Assistance Program. So that campaign is called Food for All. It's just a basic human right. Folks need to have food. It's only right that we provide food to everybody here in California. Other things that we're going to be advocating for is to ensure that immigrants who are seeking humanitarian relief in our nation and who are going to settle and be long life Californians are able to get social services that they need because that they're coming here in emergencies, because that they're seeking humanitarian relief, because they're not currently in a safe situation. So we're going to be trying to close the safety net gap for them to ensure that folks that are seeking asylum, folks that are applying through a program known as Special Immigrant Juvenile Status, and those that are applying through the Violence Against Women Act are able to get social services in a very timely manner. The other thing, as Mike was mentioning, is how do we lift people out of poverty? And last year, California really came up with a unique way by providing some of the state's first stimulus payments to Californians. And we want to make sure that, once again, all Californians are included if they're experiencing poverty. And that's including ensuring that all undocumented Californians are able to access those stimulus checks. Last year, the governor and the legislature ensured that folks who have I-10s were able to access the payments. However, we know a large population of them don't have I-10s. So we want to make sure that this year, those people are able to access stimulus checks as well. In addition to folks who are on a program known as general assistance at the local county level. Those folks are people who don't have a whole lot of resources and are absolutely in very much need, and we want to make sure that they're covered as well. So those are some of the things that we're going to be covering this coming year.
What is an I-10?
An I-10 is a number by the IRS that's given to anyone who is undocumented or someone who wants to use it for their business. And it's called, the abbreviation is an individual tax identification number. This allows people to file their taxes to ensure that they're up to date and that they're doing their fair share here in California.
You can find the link to our budget letter, November 2021, under the video. And you can stay tuned to our website in January and in May as the budget process goes along, and we will have our analysis of it. And that's it.